Hello, everyone, and welcome to the Mom Experts Pregnancy Care. As you all know, this is a platform that we have created specially for pregnant couples to bring them authentic and time bound important advice about pregnancy and immediate postpartum experiences and issues. So, today we have with us Dr. Vaidehi Marathe. She is an experienced obstetrician and gynecologist with over 28 years of practice and hundreds of awards and accolades behind her. Today we are going to talk to her about one very important topic, which is चाहिए, क्या safe है, क्या क्यों लेनी चाहिए, कौन सी लेनी चाहिए, and so on and so forth. So we thought, why not ask Dr. Vaidehi? Hello, good afternoon, ma'am. How are
Hi,
you?
good evening, good afternoon, sorry.
How are you doing, ma'am? Oh, yes, we are live again.
Sorry.
Yes,
I think something went wrong. I just suddenly got offline.
no worries, no worries. Happens all the time.
I know all the
But we are back.
time. Yeah.
Yes, and I'm glad that we joined a little in advance so that we can get
Yes.
started.
Yeah. I thought we can, get rid of these initial hiccups. Like we take
Yes,
time to get into the session. So
yes,
actually we are right on time now.
yes, absolutely. So,
Yes.
ma'am, like I was telling everyone, that there are so many confusions and different opinions and so much anxiety around a lot of pregnancy related issues, and which is why we thought that okay, we will have this page dedicated to pregnancy related information only, and
That's fantastic.
yes, ma'am. And when we see that vaccines के around इतने सारे questions होते हैं mothers के दिमाग में,
True.
so we
True.
thought we will not have any doubt in our mind, and we'll get the best expert who can answer all these questions. And of course, you're the first one who comes to mind when it comes to these
Oh,
crucial
thank
topics.
you. Thank you so much.
So,
Yeah.
shall we get started?
Yeah, absolutely. I'm ready.
Okay. So, ma'am, like I said, the topic today is vaccines during pregnancy. So, first of all, what is the importance, what is the relevance of vaccines during pregnancy?
Yeah, so first let's understand why we are talking about vaccination during pregnancy. It's not only for the mother, but it's also for the unborn baby. You know what is very interesting fact is about vaccination is it is very rightly said that colostrum, that is the initial breast milk of the mother, is the first vaccination to the baby. Okay, but with advancement in science and medicine, now we can even vaccinate the unborn child in the mother's womb, by vaccinating the mothers. So, why we are thinking of vaccinating is first because we want to protect this unborn baby after its birth in the initial few months of his age from certain diseases. Also, for mothers, the mothers in pregnancy have lower immunity compared to other individuals, and so they're at an increased risk of having sudden infections and at an increased risk of having some complications related to those infections. And that is why it is extremely important to give certain vaccinations to the pregnant mother so that we help both the mother and the baby.
Very nicely and succinctly explained. So now we all know that it is very important. But if we get started, like right from the first trimester and the second and third, so what are the important vaccines that the mothers should take?
Yeah. So, what happens during the first trimester? Everyone here should understand that during the first 14 weeks of pregnancy, the baby is developing, like means the various organs are getting developed. That is called as organogenesis, means organs are getting formed, and that's a very crucial stage of pregnancy. We are very particular about giving anything to the mother that may affect adversely the baby's development and may have certain problems. So, although some vaccines are safe in first trimester, I mean, can be given, but we avoid giving any vaccine during the first trimester to be very safe. Okay, but certain vaccinations we can start giving in the second trimester and some in the early third trimester. So let's talk about which vaccines we take. When
Yes.
generally we say vaccines, अभी भी ये है कि although we have lot of new guidelines since many years, अभी भी when ladies come to me, उनको लगता है सिर्फ टीटी का डोज लगाना है. मैंने वो टीटी के 2 डोज लगा दो. So girls need to understand there are new guidelines. So right now, what we do is we give two types of vaccines. First is a flu shot, okay, and second is of course, tetanus with diphtheria and pertussis. That's a Tdap vaccine. So
Okay.
let's first discuss the flu vaccine, okay? So in pregnancy, as I told you, the mother's immunity is low and she's at an increased risk of having sudden infections, especially the flu infections and complications related to flu infections. And these complications can also land the mother into preterm labor and preterm delivery, which in turn will naturally affect the baby because baby will be born premature and will have its own set of problems. So when we vaccinate the mother, we not only protect the mother from these severe flu infections and its complications, but it is very less likely that these babies will have flu infections in the initial several months of their birth. And it will also protect
Wow.
some complications like pneumonia in the baby as well.
Oh, very
Okay.
nice.
Yeah. So what we do, although it can be given in the first trimester, we generally give it after 15 weeks to be on the safer side. So one shot of flu vaccine around in early second trimester to avoid the first trimester. So when we vaccinate, what actually happens when we vaccinate, that also everyone needs to understand. So when we vaccinate, basically we are trying to protect the mother and the baby from vaccine preventable diseases. Okay. When I give one shot, I'm not protecting the mother and baby from all the diseases in the world. So it's only from vaccine preventable diseases. And once the mother is vaccinated, the mother produces infection fighting proteins, which are called as antibodies. These antibodies are your fighters. They are going to protect you and the baby. These antibodies can be transferred from the mother to the baby via the placenta. And this is passive immunization. I mean, the baby gets antibodies from the mother and the baby is protected. That's how these vaccines work. So we can give the flu shot at around 15 weeks of pregnancy onwards. I mean, up to near term, but ideally earlier the better. Because flu shot every year there'll be a new strain of flu shot vaccine. Because the virus keeps on changing, mutating, and we have new injection shot every year.
Yes.
So, because this protection will last around for 6 to 8 months, so we generally give in the early first trimester so that the mother is protected up to delivery.
Okay.
That's the first injection. Should we move on to the Tdap vaccination? The
Yeah.
second vaccine that we give?
Absolutely.
Yeah. So as I said, जैसे लड़कियों को लगता था कि 2 टीटी मेरा मैंने वो टीटी के डोज लगा दो, उनको लगता था वो हो गया, means vaccination is complete.
Yeah.
But now the new recommendations say that the mother should receive 2 doses, one of TD, that is tetanus and diphtheria, and one shot of Tdap, tetanus, diphtheria, and pertussis.
Okay.
Tetanus, we all know it protects the mother from tetanus infections. Pertussis and diphtheria are two respiratory infections. Typically, we are more concerned about pertussis, that is the हिंदी में इसको काली खांसी बोलते हैं या it's called as whooping cough.
Yes.
So it's one of the very serious respiratory tract infections, and it can cause. It is known, if the baby has whooping cough infection in the early few months of his life, before the baby gets actual vaccination, baby is old enough to get actually vaccinated actively after birth. So the initial few months, if the baby gets whooping cough infections, the studies show that more than 50% of these babies need hospital admission. They need hospitalization, and many of them can suffer severe life-threatening infections.
Oh my God.
So it is recommended that not only the mother, but the recommendation is that even adults who are going to be in close contact with the baby should also get this Tdap vaccination.
Oh.
So these vaccinations, are given to the pregnant mother so that the passive immunity, that means the antibodies, are transferred from mother to the baby. So after the few months after the birth, baby will be protected with these antibodies before it is old enough to get actively vaccinated. That's the whole thing.
Okay.
There's one
Very
more vaccine actually, not right now available in India. It's available in the US. RSV vaccine. It's another respiratory tract infection. They are given. This vaccine is given in, I think, US, but not in our country right now. It's not available. So you should just telling you that you should know that there's one more vaccine, but not given in India right now.
Okay. I think two very important things also got answered as you were speaking, ma'am. One is that a lot of mothers say that some doctors say that flu vaccines you should take, some say that it's optional, so what should we do? So I think, like you very rightly said, that it's very important that you go and take that shot, because the strain is ever changing, because it protects you who already has a lower immunity and your child also.
Yes.
So mothers, if you're watching this, please go ahead and take that flu shot. Do not hesitate. Yes.
Yes, they must take it
Yeah.
because it will not only protect from flu infection, but it will protect them from the complications arising from flu infections. These complications may land them into preterm labor and delivery and then subsequent problems to the baby.
Yeah.
So it's extremely important. There are two ways about it. Loo ki nahi loo, lena hi hai.
Nahi hai. That's the bottom line. And another thing that you were saying, that not just the mother, but even people around who are going to handle the baby, we also need to take
The
some vaccinations. So it's
Tdap,
always
that's the
best,
Tdap, yeah,
yes,
pertussis, whooping cough, yeah,
especially the pertussis one. And
yes,
please check with the experts, with your doctors around you, and make sure that you are taking all the right precautions and vaccinations. So that's very,
absolutely.
very important thing answered. So, ma'am, some people may have this question that what if there are some childhood vaccinations that we have skipped? अगर हमने नहीं लिए थे पहले तो अब वो सही समय है क्या लेने के लिए? And what are these some of these vaccines?
Yeah. So it's a very, very important vaccine. Krishnali, if any young girl comes to me for any problem in the world, I make sure that I educate them about pre-marriage counseling, preconception counseling. So because when you see a doctor before you have conceived, we would know your immunization status. Okay. So it's important that your childhood vaccination file is well preserved with you. You have some documentation which vaccines you've taken. For certain infections, we can do antibody screening and find out if you don't have the records, then we can find out whether you've been vaccinated or not. But if there is no record, you do not have the vaccine, we cannot do the screening. There's certain vaccines are important before you conceive. Okay. So first and foremost is the rubella vaccine, which covers MMR, that's mumps, measles, rubella. It's very important. Rubella, every girl should know who's seeing this live today, that rubella is a routine, a viral infection like any other viral infection, which will come and go like fever, rash, pain, and all of that. And but we will not know whether this is rubella infection. Okay.
Okay.
So this viral infection, if this pregnant mother has this infection during pregnancy, this rubella virus can pass on from the mother to the baby via the placenta. And the rubella virus is known to cause serious problems, congenital defects, and malformations in the baby. So this is
Okay.
one infection which is very, very easily preventable. So every young prospective girl must get vaccinated against rubella. Now government has taken up this initiative that they are vaccinating school girls nowadays. So now hence moving forward, henceforth we may not have many girls who are not yet vaccinated. But right now young girls who are married or about to be married, when I have, many of them are not vaccinated.
Yeah.
Most of them are not even aware that they have to take this vaccine. So it's our job, like if you of you are seeing this live, if you have many friends who are young, not yet married, are about to be married, or planning a pregnancy in future, make sure that they've taken this rubella vaccination, because once you take this vaccine, it is prudent that you should not conceive for the next 1 month minimum, because
Okay.
initially it acts like an infection in the body,
Yes.
after which it produces the antibodies and then the baby would be protected. So first is a rubella vaccine. COVID-19, yes, all of us have been vaccinated. Make sure you're vaccinated, although the disease now in India is not so prevalent, but that is another vaccine. Third is a HPV vaccine. It's not related to pregnancy, but every young girl must get protected and must get vaccinated with the HPV, that is the cervical cancer vaccine.
Yes.
Recently, the Pooja Pandey controversy reignited the entire conversation.
Yes.
We have been talking about it all this while, but
Yeah.
whatever way she did wasn't very nice, very distasteful, but
Yeah.
at least it started a conversation around cervical cancer.
Yeah.
So this one vaccine, which will protect the young girls from, I must tell everyone that cervical cancer is the only cancer, genital cancer, which is vaccine preventable. It can be prevented. No other cancer can be prevented with a vaccine. And when you have a vaccine for some cancer, what are you waiting for? What is it that is making you think about a vaccination? Okay, so each and every woman, the simple protocol, I'll just quickly tell you
Yes.
that there are 3 types of vaccines. One is a quadrivalent, the other is a nonavalent, which contains 9 virus strains.
Okay.
The quadrivalent means which covers the 4 virus strains.
Hmm.
One is an Indian make vaccine, which is Servavac. Other is a Gardasil, which is not made in India. Costs vary, but they have the same effect. The other one is a nonavalent vaccine, which will cover 9 virus strains, out of which 2 are known to be very highly carcinogenic. HPV virus can cause cervical cancer, anal cancers, throat, the back of the throat, that cancer, anal cancers, and vaginal cancers. And in men, they can also cause penile cancers as well. So that's why we say most of these cancers are caused because of HPV vaccine. And when you have a vaccine for that cancer, please get vaccinated.
Yeah.
What's the best time? The best time for this vaccine is initially is between 9 to 14 years, I mean before the 15th birthday.
Okay.
That is why it is the best time, because at that time your body's response to the vaccine is the best immune response.
Okay.
The second best time is before that before that girl becomes sexually active is the second best time. And the third best time is before you become 45 years of age. So from 9 to 45 years you can vaccinate these girls. The doses will vary according to age. If you vaccinate before your 15th birthday, you require only 2 doses. But if you vaccinate after your 15th birthday, you require 3 doses. So that's another, yeah. So COVID-19, MMR, mumps, measles, rubella, HPV vaccine, chicken pox. Every girl must be aware that, because chicken pox, if you have it in pregnancy, again can cause lot of problems in pregnancy related to the baby. Okay, then hepatitis A and hepatitis B. These vaccines are kind of mandatory. Everyone must, whether you're a girl, you have a uterus or no uterus, all of you must take it. But for women, these vaccines are extremely important.
So now, just to get this on record, if you have not taken HPV vaccine before and if you are pregnant right now, can you take it?
Yeah. Another very important point about HPV vaccine. HPV vaccine cannot be taken during pregnancy, but after you deliver, even during breastfeeding phase, you can take this vaccine. So many times this has happened with my patients. They have started the vaccination. The older girls, more than 15 years of age, they have to take 3 doses. One if they take today, the second after 2 months, and the third after 6 months. So many times it happens that after the second dose and before the third dose, that is 6 months later, they have already conceived. So what do we do in those cases? We ask them to take the third shot immediately after breastfeeding time.
Immediately after they deliver, during the breastfeeding time. So
yes,
very, very important. HPV vaccine is very important. Please take it before you conceive. And if you haven't, please take it
yes,
after you deliver. So
yes.
very relevant point. So one final question from my end, and then we'll take questions from the audience. Is there any vaccine that you should not take, or any type of vaccines that can harm your baby and that you should avoid?
During pregnancy, apart from these 3 vaccines that I told you, TB, Tdap, and flu vaccine, no other vaccine should be taken during pregnancy, period. There are certain vaccines which can be given to pregnant mothers when there are some risk factors or some special situations which your doctor will assess. So I really don't want to discuss about it because it will create confusion. But to tell you briefly, like hepatitis A, B, pneumococcal, meningococcal vaccines, yellow fever vaccine, Japanese encephalitis, then rabies, post-exposure prophylaxis. These vaccines can be given to pregnant mothers only in certain risk factors or with certain special situations only.
Yeah.
But don't, take it in thinking that you can take this. No, only with your doctors. It's the doctors. He will or she will decide depending on your situation whether you need that vaccine during pregnancy. Otherwise, only 3 vaccines during pregnancy.
Okay. Very, very nicely and very crisply, clearly explained. So, ma'am, any parting thoughts, any final message that you would want to give to all our pregnant mamas?
So, re-emphasizing the importance of pregnancy, girls understand during pregnancy your immunity is low. So, you are likely to get certain infections, certain common infections like flu can also land you into trouble and you can have serious complications. So, do not think twice about vaccinations. Don't hear stories on Google. Please do not Google, and ask your elders who have no knowledge about medicine, about vaccination. Only consult your doctor. Vaccinations are mandatory. It not only protects you, but it also protects your unborn baby in the womb and in the initial few weeks or months of its life when the baby is not old enough to get active vaccination. So these vaccines must be taken. And pre-pregnancy, one more important message, please remember your pre-marriage and pre-conceptional counseling and checkups with your gynac. Because that is the time we tap a lot of problems. We can counsel about vaccination, we can counsel about so many other things about your reproductive life. But since we're talking about vaccination, we can keep track of your vaccination, whether you've missed out on any. So well before your pregnancy, we would make sure that you're vaccinated against major preventable diseases.
Absolutely. That's a very, very important advice. If some of you here are thinking of conceiving, then please first go and visit your gynecologist. Make sure that your vaccinations are on mark. And if you're already pregnant, then make sure that you watch this session again and get your vaccines on mark. So again, thank you so much, Dr. Vaidehi. It was a
My
very
pleasure.
Thanks once again for taking out time. And
Yeah.
guys, if you have any questions related to vaccination or anything else, please put them down in comments, and ma'am or us will make sure to answer those.
Yeah, we'll answer all your questions. Happy to be there always. If you have any questions, get them cleared. Do not keep them in mind and then ask people who have no knowledge about
You have no,
medicine and
and
science.
like you said, please do not Google. It's the worst thing to do when you are in
Worst
this.
thing to happen.
Yeah,
Absolutely.
yeah.
All right
Okay.
then.
Thank you so much for joining. Thank you, ma'am.
Yes. Thank you. Thank you, Krishna.
Bye.
Thanks for having me with you. Bye bye.